And I'll tell you that the National Bureau of Statistics says the national average cost of a healthy diet per adult per day was 1,041 naira in May 2024. This marks a 1% increase from April's 1,035 naira. The cost of a healthy diet represents the least expensive combination of locally available items that meet global dietary guidelines, excluding transportation and meal preparation costs. The highest average cost of a healthy diet in May was in the southeast at 1,119 naira, while the lowest was in the northwest at 919 naira. The most expensive states were Ebonyi 1,225 naira, Abia 1,215 naira, and Anambra 1,205 naira, and the least expensive were Kano 898 naira and Jigawa 899 naira. Since October 2023, the cost of a healthy diet has risen by 32%, driven by increases in starchy staples, legumes, nuts, seeds, and animal source foods. Now, to discuss this, we're joined by Dr. Chinasa Amadi, an international board-certified lifestyle medicine physician, as she joins me from Lagos, Nigeria. Dr. Amadi, thank you so much for joining us on the news.
Thank you for having me.
So to be quite realistic, for me, I think 1,000 naira per day for someone to get a healthy food seems to be out of the question, if we were to categorically put it. But then I'd like to find out from you, as a certified lifestyle person when it comes to food and nutrition, do you think that is actually doable, 1,000 naira to feed healthily? Is it possible?
I think it first of all depends on what you define as healthy. Yeah, because the group still classifies animal protein is having the most, the highest percentage of expense as per in the cost of healthy diet. So animal protein is still a lot more expensive. Plant options are still a lot cheaper, with legumes, nuts, seeds as the cheapest in the food group category. So is it possible? It's all about remodifying your choices. So you're not going to it's not business as usual anymore. You're going to have to now look for what is available and affordable for you and sustainable in the location you are in. So it can be when you decide that you don't need to have a lot of obstacles in your food. And yet, that will still be a healthy diet.
So what about if what is available within your locality is not healthy enough?
So, it's all, you have to, in each location, I always say we're blessed. In each location, there's something available. I grew up eating greens and ugu, but now I am using ianapaja for my food. Ianapaja is a vegetable that is called, they also call it hospital is far. I have never eaten that before now, but because that is readily available, it grows literally wild. You can now use moringa, grows readily wild, and it's used in making soups in the north. So now, now that we are here in Lagos, we're learning to incorporate moringa leaves in our foods. So you have to acclimatize your taste buds to the location where you're in. There's something healthy for you there. You can still have your grains, your ogi, your pap. Instead of just using corn, you're adding your millet and adding your dawa, grinding them together, grinding well, and you do not need to sieve. When you don't sieve it, you are getting more probiotic, you're getting more fiber, and you are getting more quantity for the same value. So before you sieve your pap, and you're getting a lower amount of pap, but now you don't sieve it, you have doubled the ration and you have saved on cost that way. So a lot of modification that can still be very healthy, and you're going to just learn to adapt to new tastes. That's all.
Okay, we know that is quite challenging, most especially for those who are not educated along this line. But I'd like to find out from you, Dr. Amadi, do you foresee, in the light of this conversation, the possibility of an increased prevalence of diet-related chronic diseases among the population?
So I think it can swing both ways. It can swing both ways, because if people are educated as far, you can actually eat this. You can have golden melon is in season now. You can get golden melon instead of waiting for watermelon or waiting for apples that are a lot more expensive. Go for the yellow golden melon. So people say, I don't like it. I don't eat it. Now, can you start eating it? it will reduce the diseases that can arise. Instead of looking for what is fried, what is processed, or what has so much oil, you need to now, but we're forced to reduce our portion. We've been forced to reduce the amount of oil we use, which is not even good for our health. So we can actually use this. I was telling someone yesterday that now 200 naira fufu is already portioned for you. Before you eat it this size, now you're just having that 200 naira more. And that's enough for an adult, literally, unless you have just natural longer foods. That's a different situation. But then it's important to now modify your taste buds and you can still maintain good health, because you can't even buy cough syrup for 1,200 naira now. It's a lot expensive now.
So we talk more about those who might not have enough funds when it comes to getting quality food for consumption. But what about those who actually have the money but prefer to eat mostly processed foods? Do you think that's a habit that can't be broken?
It can be broken with consistent education. One thing humans can change if they want to change. So just the way if you choose to change a habit, you don't have to wait till you fall sick, especially when you can afford it. Why will you make... We've related processed food with affluence, and that is where we need to change that thought pattern, that because I'm having a burger, I'm having a sausage, so I am affluent, I'm wealthy. No. You're just getting a wealthier type of choice disease. So it's important to consistently educate the public about, hey, go back to the basics, eat foods closer to the ground, the less processed, the better, and the better for your health. It's not a sign of affluence. That thought process needs to change. And that can change with consistent education, consistent advocacy of the right information. Okay. That will change the game.
Well, education is what you have done on the news this afternoon. Thank you so much, Dr. Chinasa Amadi, for sharing your thoughts with us.
Thank you for having me.